Hi. Hello. Hey, hi, hello. So I'm sure you're looking at me and going, Misty, that looks suspiciously like a hospital room. And you would be correct. I am back in the hospital. So I can't remember if we talked about it in my last video or not. My incision opened. I think we talked about that. My incision opened and I got my staples out. So today is the 20th. Yeah, 20th. So Friday the 20th of June. We are 3 days away from being 30 days out from my C2 to T2 fusion. So last Monday, I started an antibiotic because it looked like my incision was infected. They put me on 500 milligrams of Kelflex, whatever it's called, for 10 days. Tuesday, I saw the 10th. Tuesday the 10th, I saw my surgeon and they removed my staples. And Wednesday, I started to feel better. Like I still have pain in my neck, but I was able to get up and start walking around. Like 2 days ago, was it? 3 days ago now, I walked 140 feet. So basically almost an entire lap around the rehab facility where I was staying. So I think it was Monday, Tuesday, Wednesday. One day, I asked them. So last Friday, I had. Let me just pull. I can't insert pictures because I'm filming on my phone. I'm filming on my iPad. Let me find what it looked like last week. I don't know if you guys are gonna be able to see that. So last week, so that's last Friday. That's what my incision looked like, opened up. Now, if you are, I should have said trigger warning. If you don't want to see some grossness, don't look. So this was what it looked like yesterday. And that's up close. So we went from that little bitty, tiny little bitty hole to that. And so I had asked to have a picture of it taken after she cleaned it. The nurse has been changing the dressing every day, and I was livid that she let it get that far without saying anything. Because to me, that thing looks angry, it looks infected, it looks like half my neck is coming out of itself. And I was pissed. So I spoke to this was Wednesday. I spoke to the nurse practitioner and I said, we need to talk about the wound. And she's like, you don't have a wound. I said, I have a wound. She's like, you don't have a wound. I said, I have a hole in my incision. That's a wound. She's like, no, it's still a surgery incision. I said, no, it's not. I said, because everything else is closed up. That's a wound. It's a wound. I have a wound. So she was very hesitant to call it a wound and kept kind of talking to me in circles about it. And I was like, I'm not having this. So I sent the pictures to my doctor and I called the after hours number that night because that's the only way I knew how to get in hold and actually speak to the PA because the medical assistant was giving me the runaround and she was talking in circles too. So she was like, yeah, she's like, it doesn't look great. And she said, I want you to continue 250 milligrams. I said 250 milligrams of what? She's like, of the antibiotic. And I said, I've been taking 500 milligrams 4 times a day for 10 days. And she said, that is not what I prescribed. She said, you should be doing 250 milligrams 4 times a day for the last 7 days. I said, so here's my thing. I said, I'm on double the dose of an antibiotic that I've taken 3 days longer than you had anticipated. I said, I'm very uncomfortable. And she said, wound care was coming, the rehab's wound care was coming yesterday. She said, let's let you talk to their wound care, let's let you talk to their infectious diseases doctor, and then we will go from there. She said, I got a message yesterday saying that they would much rather me be here at Methodist for them to treat it if one of those doctors thought that it would be necessary. So I said, okay. So the wound care doctor just was like, put some silver on it and put a like, cover it. That's literally all she said. I'll see you in a week. Well, here's the thing. I was scheduled for discharge this coming Monday. So that would be what, the 21st, 22nd, 23rd. Monday the 23rd, I was scheduled for discharge from rehab because I'm walking. I'm up walking around, can get around, doing really well. And I was like, I'm not going to be here in a week. So what do we need to do? So they were like, the infectious diseases doctor or PA, is she an NP? I don't remember what she said she was. Ow, sorry. They said she'll be here later today and she'll talk to you about it. So she was like, I really want to get you on a IV antibiotic. She said, you've got metal. She said, I'm concerned, that this is a surgery incision at your spine. She's like, I'm concerned. And I said, I don't want to be here on an IV antibiotic. I said, I would much rather be in a hospital. I said, no offense to you or the wound care doctor. I said, but you're not here often enough. I said, I would much rather be in the hospital where I can see somebody every day if I need to. And she said, I 100% agree. So they transported me last night to the hospital. I didn't come via ambulance. I came via van. And initially when I got here, she was like, I don't know what I'm going to do with you. And I was like, well, I have to transfer out of this chair because the chair they had me in was actually a resident's chair and they were just letting me borrow it. So they got me back real quick. And the nurse was like, I remember you. You were just here a few weeks ago. And I'm like, yeah, I was just here a few weeks ago. So told her what was going on, showed them everything that was going on, and they got me started on an IV, gave me morphine. I didn't even ask for pain meds, but they gave me morphine, gave me something, Zofran, and it basically knocked my ass out. I texted Rob and I was like, or I FaceTimed him and I was like, I said, they gave me morphine. I can't promise that I'm going to be awake much longer. And he said, keep me posted. And I said, I'm going to guess the next time I'll, tell you what's going on will probably be middle of the night. So it was like 2:30. They woke me up, gave me more morphine, and finally had a room for me. So I came up here and they were like, I can't, the paramedic that moved me, he's like, I can't believe they're moving you. He's like, normally they won't move people overnight. He said, and you're going to the 6th floor. I was like, I don't know. Listen, dude, like seriously, because this is surgical floor. So get up here, they get me settled, get me in bed, and I slept for a good 3 or 4 hours, I think, before they started getting me up. The kitchen started calling a million times, so I would order breakfast. So I got up, had breakfast, and saw the rounding doctor. Was that before or afternoon? I don't remember. I've slept a lot today. I'm still hungover from that morphine. I swear I'm still hungover from the morphine. So anyway, he said, he's like, your numbers look good. He said, your white blood count, he's like, and everything. And I told him, I said, I said, my concern is I have CVID. I said, my white blood count when I went into the hospital last year with pneumonia was 2,000. I said, so my white blood count runs low anyway. I said, so I have that, I have an autoimmune disease, and I'm type 2 diabetic. And I said, and this has gone from literally nothing to something in the span of a week. And I said, and that's my concern. And I said, plus I'm in a rehab. Number one, I'm not in a room by myself. And I said, they keep it somewhat clean. It's like, if I have an infection, and again, the nurse didn't say anything about it. She didn't say it looked different or anything. She didn't say anything about it. So I was like, I'd much rather just be at the hospital. I said, and if you have to treat me and let me go home, you'll treat me and let me go home. So last night I didn't get here till like around 9. So they took a blood culture so they could see if bacteria was going to grow to see what kind of infection I have, if I do have an infection. So we're waiting for that. Once that comes back, if I have an infection, they'll treat me with IV antibiotics. If I don't, they're going to send me home with wound care. I met with a wound care doc. She wants to see me once a week. She's really nice. She put me on a bunch of vitamins, and then she's like, Juverne. I don't remember what she called it. It's like, ooh, I've already been drinking some of that sometimes. She's like, oh, good, great, minds think alike. And I was like, yeah. I said I got mine off Amazon, so I think they're gonna give me some of that. But the issue they're having is they can't keep my blood pressure up. Like, it was low. Like, when I woke up, it was like 80 over 50 or something like that. And that was up from what it had been. So it had gotten real low. And she was like, do you deal with low blood pressure? I'm like, yeah. I said, most people think that I have high blood pressure. I said, now, I had high blood pressure in the rehab. I said, but that's not normal. I was like, I've been saying that for weeks and weeks now. It's like, it's not normal for me to have high blood pressure. It's normal for me to have like regular to low blood pressure. So they started me on saline. I don't know if you guys can hear the IV pump. And that's honestly just to kind of keep my blood pressure up, because it hasn't been, like, I think earlier it was like 89 over 67. And I think that's the highest it's been. So yeah, there's that. And I had to deal with the stupid director of nursing. I am going to make a complaint. Like, I'm filing a complaint. You guys know how I am about people. There's nothing that will get me pissed off faster than someone trying to gaslight me in the medical community. And if you're a guy trying to gaslight me in the medical community, fuck off. He kept going, well, why don't, because the rehab is next door to the hospital where I live. Like, we live right next door to a hospital. If you didn't know that, now you do. So he was like, well, why don't we just get you across the street, it was Baylor. He said, when you were with Baylor those few days, they gave you a Baylor case manager, and they now are going to follow your care all the way through. So if you go to Baylor, they can follow your care, blah, blah, blah. I said, my surgeon's not at Baylor. I said, my surgeon's at Methodist. And I said, and I've already been talking to her PA. I said, I literally just got off the phone with her PA, and she told me to get to Methodist. And he was like, but we could just get you set up with a doctor's appointment. I was like, I don't want to go to a doctor's appointment. I want to go to the hospital. He's like, why would you want to go to the hospital? Most people don't want to go to a hospital. I said, I want to go to the hospital because that's where my surgeon is. And I said, that's where I've been instructed to go. I said, so that's why I want to go. I said, I have an infection that you guys have allowed to kind of blow up over the last week. I said, you have a wound care doctor and an infectious diseases doctor that's here once a week. I said, I am scheduled to go home on Monday. I said, I want to go to Methodist where my surgeon is. Okay. I just wanted to double check. Most people don't want to go to the hospital. I was like, well, I don't want to go to the hospital either. I said, but I want to go where my surgeon is. So my surgeon's at Methodist. And that's where she's advised me to go. And that's where you're going to take me. You guys, I was so pissed. I'm still so pissed about it. And a couple of people overheard. They're like, you need to call and report him. They were like, he acts that way towards everybody, even his own staff. And I was just like, because he was like, well, your blood work looks great. I'm like, I'm glad my blood work looks great. I said, but you haven't seen the wound. You haven't looked at the pictures. You haven't seen what's going on my back, on my neck. We're talking about my spine. We're talking about something that could get into this wound and get into my spinal fluid and like cause an issue or whatever. So anyway, I've been here now not quite 24 hours. It's like 6:20, almost 6:30. Rob's on his way. He had to work today. He worked overtime last night. And I told him, I was like, there's no reason for you to try to take off today. I'm going to sleep most of the day, which I did. And I said, we'll just get here and we'll go over it. So he's like, what do you need? And I was like, some clothes. Because I don't think they're going to keep me the entire weekend unless something's grown and they need to give me an antibiotic. I think that's really what we're waiting on. And then I will go home with home health care. So I told him, I was like, pack a couple, changes of clothes for me, deodorant, stuff like that. I was like, can we please bring my electric toothbrush so I can brush my teeth? I feel like they haven't been brushed in 2 months. And then I ordered some sugar-free gum. And I can't remember if it was yesterday or the day before yesterday. I asked for a diet cherry limeade. And he said, I'll get you one on Friday. So today I was like, can I have my cherry limeade today? So he's going to bring me a diet cherry limeade. So yeah. So food's been all right. I haven't been eating much. They weighed me. I am up 2 pounds from where I was the other day. But she's like, you've got blankets on and stuff like that. So I'm hovering right around where I was. And once I get home and can get on my scale, I'll eventually do an official weigh-in. So I was planning on going home on Monday, and now I may end up going home, I don't know, maybe a day sooner. Today's Friday. I guess I'll find out either later tonight or first thing tomorrow what's going to happen. But per usual, I'll keep you guys posted. This has been, I was like, I want to go to my house where I live. I don't want to go to the hospital. I want to go to the house where I live. I said, but also, I have this huge hole in my neck that we've got to fix. It's like, I don't, do we need to stitch it? Do we need to clean it out and pack it? Like, what do we need to do to help it get better? That's what I would like to do. That's what I would like to happen. So yeah, so what are we, 4 days later? Shoot. And it's nothing I've done or nothing I haven't done. I mean, it's in the fold of my neck, and everybody that has this surgery has that issue with that part of their neck, of their incision. So it's not just me, but I am quite ready to be done, to be well, and to be up, moving around. So yeah. Anyway, say a prayer, light a candle, all of the do. I hope you guys are doing better. I hope I don't have to be here all weekend. At least the bed is a bit more comfortable than the last bed I've been in for the last few weeks. And yeah, so anyway, that's it. I'll keep you posted. I hope you guys are doing well. I'll talk to you later. Bye for now.